Interpreter Programs Manager at the Virginia Department for the Deaf and Hard of Hearing. She oversees sign language interpreter assessment and interpreter service coordination for state agencies and the Virginia court system. Originally from Maryland, Karen earned a Master's of Interpreting Studies and Communication Equity from St. Catherine University and has been an adjunct instructor in the interpreter education program at J. Sargent Reynolds Community College since 2014. She's her department's liaison to the Virginia Department of Emergency Management, and from March 2020 to March 2022, she served as the Access and Functional Needs Officer, providing accessibility guidance to the Unified Command during the COVID-19 pandemic response and complex coordinated emergency declarations. So just make sure, as a reminder, all your lines are muted. Throw your questions in the chat box. And Karen, take it away.
Thanks, Kate. Let me get my screen squared away here. Make sure, hopefully you are all seeing my PowerPoint, the title slide there. Please let me know that I've shared successfully, because as we all know, sometimes that can be tricky right off the bat. Thank you, Kate. Again, my name is Karen Bram. Thank you so much for inviting me to speak to you this evening. I really appreciate the opportunity. Last year, I presented along with a couple of other people on these similar topics. And so tonight, I'm sort of flying solo with this topic, and appreciate your understanding as I go through some of these sort of essential elements of knowledge when it has to do with accessibility. Some of this might be a refresher to some of you, and others, maybe this is the first time you've really heard this presented in this way. So hopefully everybody will come away with at least one nugget of new information that will be helpful to you in your job. The goal for tonight is, let me review a couple of options here as soon as I can get my cursor to recognize me. There we go. Our objectives for tonight are to make sure that we review the definition for the term access and functional needs, review some planning considerations for access and functional needs during an emergency, which would include points of dispensing, clinics, and shelters, which I know are the main environments where the MRC might be activated during an emergency. And how MRC volunteers can assist those with access and functional needs during an outreach event, for example. So some of what I go over tonight, I probably just as a knee-jerk reaction will mention vaccination, because a lot of the efforts that we've been working with in the last 2 years have had to do with, of course, a COVID-19 environment. So whereas I probably out of habit more than anything else will refer to testing and vaccination for COVID, most of these guidelines are applicable to any sort of emergency sheltering situation, emergency medical situation, but also during blue skies times. A lot of these are just basic nuts and bolts principles of how to interact with people with access and functional needs and try to meet them where they are. So as far as a functional definition that we can work with, access and functional needs has to do with the needs for individuals who need assistance during due to any condition, which could be temporary or permanent, that would limit their ability to act. And by that we mean activities of daily living that would be something that typically people would not need assistance for, but people with access and functional needs would be requiring attention above and beyond what is typical in a operational setup. So to have access and functional needs doesn't require that the individual has any sort of specific diagnosis or any specific evaluation. So when we go into a service mode, we don't necessarily have to know what the person's diagnosis is. The essential information we need is whether or not they have accessibility requirements or needs that they would share with service providers so that we can go ahead and allow them access to that environment. So populations with access and functional needs might include people with disabilities, whether that be sensory, cognitive, mobility, and other types of disabilities, individuals with limited English proficiency or low literacy, older adults, children, and individuals with limited access to transportation. access and functional needs as terminology in emergency management is sort of an umbrella term. And there are a few other sort of demographics that might or might not be included in access and functional needs as far as operational considerations. But these are sort of the top 5. And of these, tonight we're going to go over considerations for people with disabilities, limited English proficiency or LEP, older adults, and limited access to transportation. And so hopefully those are sort of the most prevalent demographics that people have the most questions about interactions. So we'll start with people with disabilities. And of course, a person with a disability is a person who has a mental or physical impairment that substantially limits one or more of their daily life activities. You might hear them described as activities of daily living. You might hear them described as a substantial gainful activity. But generally speaking, in a shelter environment or an emergency environment, that's going to limit a person's ability to see, to hear, to move around independently, to understand the messaging or the information that's being given to them because they have some sort of language barrier, and the ability to understand cognitively and process the information that's being given to them in the language that they most readily understand. So the Americans with Disabilities Act, has, of course, a legal definition that has to do with levels of impairment and how long the disability is lasting for that person. Usually it's a continuous period, not less than 12 months. And it covers people who have an actual or perceived disability. So again, it doesn't necessarily mean that they have had a specific diagnosis, but it is recognized that that person needs assistance with their activities of daily living for some reason or another. It's not really our place as service providers to require a diagnosis from that person. So if they enter your environment and they profess to need a particular type of assistance, then we take them at their word that that's what they need in order to access the environment that they're coming into, and then we try and provide them with what they need. And that would be both access physically and access to communication. So along with the Americans with Disabilities Act, the Civil Rights Act of 1963 also pertains to this topic because it covers access to effective communication for people who are limited English proficiency. So, along with being the right thing to do, there are requirements by law that we want to go ahead and try and make sure that we're following and doing our due diligence to provide access to a given space. I'm not a lawyer, but having a general idea or understanding of what is encompassed in the Americans with Disabilities Act and the Civil Rights Act of 1963 is sort of a baseline for being able to provide the adequate accessibility. So when we're talking about a disability standpoint, how many people are we really talking about here? Generally speaking, it's recognized that between 22 and 25% of the population of the United States is a person who's been identified as having a disability of some kind. So that's roughly going to be 2 out of every 10 adults, something along those lines. And it does vary by state, and it varies by the type of disability that you're talking about. Generally speaking, mobility disabilities are the most common or prevalent, but then there are also those that have difficulty seeing, difficulty hearing, need to use a wheelchair to get around, might have some kind of cognitive impairment. And so it's not a one-size-fits-all term to say people with disabilities. There are, of course, many different considerations. And so it's a challenge to be able to assist that person to access their space depending on what type of disability they have. Keep in mind as well that there are ranges or levels of impairment. Impairment being sort of the medical term and not the term that we usually use about the person themselves. We'll get into that a little bit later. But as far as vision is concerned, sometimes people have what's called low vision, meaning that they have a low capability of seeing, but they do have some functional vision that they try to employ in their daily activities. And the same with difficulty hearing. It's much more rare to be profoundly deaf than it is to be hard of hearing, for example. There are many more hard of hearing people in the United States than there are people who are profoundly deaf and who use sign language to communicate. So a lot of times in people's minds, they think when they think blind or deaf, they think 100% loss with no usable vision or hearing. And by and large, that's not the case. Usually a person will have some residual vision or hearing, and so they will try and employ that and will need accommodation to get them the rest of the way. So that's one thing to consider, that it's not a one size fits all, and disability comes in a range of levels of impairment. In Virginia specifically, statistics coming from 2019 gauge that here in Virginia, we have an average of just shy of 12% of our population is recognized as having some type of disability. So we're generally speaking lower than the national average, but it does vary by region. So the county with the highest percentage of people with disabilities is Dickinson County, far southwest, with 28% of the population of that area recognized as having a disability, whereas in Loudoun County, the percentage is just shy of 6%. So depending on the region that you're working in, it may be more or less likely that you on a daily basis run into someone who needs accessibility accommodations provided to them. And then particular disabilities might be more rare than others. So you may or may not have worked with a person who is hard of hearing or who has a level of hearing loss that's diagnosed as being deaf, but you may or may not have run into someone who is deaf-blind, for example, a combination of deafness and blindness. So depending on the region that you're living in, you may or may not have had common interactions with people with disabilities of various types. So along those lines, keeping in mind that people, disability is diverse. So you may also not be able to readily recognize that someone has a disability. It might not be visible to you. It might be something that we call a hidden disability. But that doesn't mean that the person doesn't need accommodations. So listening to that person is going to be very important, and taking them as the expert in their own disability will be helpful to you in being able to provide them with the accommodation that works best for them. There are some disabilities and health conditions that might require that you provide accommodations from the very beginning of your interaction with them, starting with the appointment process or the check-in process. So from start to finish, they might need assistance, whereas some disabilities require assistance in only a portion of the service provision process. So keep in mind that whereas a person may or may not need assistance registering on a website, for example, they might need assistance once they arrive at the service site. Maybe they need assistance being able to get to the building that you are providing the service in, the shelter site or the vaccination center, for example, and they can get there having registered beforehand, but then they need assistance getting from the car to the building. So accessibility has to be built into the entire process from start to finish. Some people need assistance from start to finish themselves, and some people need assistance as they go during particular parts of a process. And again, people with disabilities know their own accommodation needs. So asking them what they need and working with them to find reasonable accommodation is going to be the most successful approach in being able to give them what they need to access the space that you're working in. But we always want to, as well, try to make sure that we are providing accommodations in an as culturally appropriate way as possible. So, that has to do with understanding that a person with a disability is a whole person, and they bring a life experience that is not only about disabilities, but is also about the culture that they grew up in, the language that they grew up using, the type of life experience that they've had, whether or not they've been exposed to a medical environment before or not, for example, or whether they've ever been to a shelter before, for example. So addressing only the accessibility as far as the disability component is concerned might not give the person everything that they need in order to be able to access that space. Just a word about terminology, no pun intended. Of course, we're always trying to aim toward using language that is appropriate for that person in order to respect that person, try to take into account what the current community feelings are on particular terms. And so I've listed a few here that are kind of the top ones that would be helpful in order to avoid the terms that we no longer tend to use and gear towards the ones that are most readily accepted by the disability community. Framing things as the disabled as a group is not as favored as using a term like people with disabilities or a person with a disability. They're not a monolith. And so taking it from a person first perspective is usually best practice. But having said that, there's the cultural aspect as well. So some groups, the deaf community, for example, take pride and ownership in their deaf identity and see themselves as a cultural group with their own language and behaviors. And so the deaf community at large prefers to be termed as a deaf person rather than a person who is deaf. So, it might be the feeling that you can just fall into a minefield with using the wrong term, but just keep in mind that you can model after the person themselves and use the type of terminology that they use and what they find acceptable, and coming that far with them and trying to make that rapport with them by using terms to describe them that they find acceptable will help you with being able to create a rapport with them that makes it easier for you to provide service to them. So another one I wanted to point out is, as far as the deaf community is concerned, the term hearing impaired is one that can be sort of difficult to know the guidelines on. But generally speaking, the term hearing impaired is a medical diagnosis, and people who are deaf, the deaf community, prefer the term deaf rather than hearing impaired. In fact, the state of Virginia several years ago determined that they would change in the Virginia Code all the mentions of the term hearing impaired in favor of deaf or hard of hearing. So that's something that's important enough to the community that they lobbied the legislature to be able to go ahead and have that changed. Having said that, the Americans with Disabilities Act does use the term impaired as a medical term in order to be able to determine those levels of impairment. So in a medical setting, the word impairment is more often used than, say, out in the community or in an educational setting. Again, the terminology is something that people can easily have a misstep. But what I've found is that if you model after the person's preferences, then again, that's listening to them up front and kind of accepting how they prefer to speak about themselves helps to build a rapport that makes it easier for you to be interacting with them as a professional. So there are several environments or several accessibility considerations that really are sort of top of mind. The first one I'll talk about is ease of access to technology, ease of access with technology as well. So both getting to the resource of the internet, digital devices, being able to understand how to obtain access to the use of technology, along with, once they have access to the use of technology, do they know how to actually operate it? So one thing that became evident during the COVID-19 vaccination effort, for example, is that there were individuals across the state of Virginia who either did not have access to internet at all and therefore could not access the Vaccinate Virginia website, for example, or they could access it, they could see it, but they didn't understand how to use it. And so those individuals were more often benefited by actually using the phone and calling a call center and having a call agent assist them with their registration process. So just having access to technology doesn't necessarily mean that a person is going to be able to use it successfully. And it's good to sort of set up alternate ways of providing information, alternate ways of communicating that information other than assuming that the individual knows how to use the internet successfully. Technology also has to do with the digital environment. And so making sure that we understand that not everyone can see digital content, not everyone can hear the digital content. So, for example, there was an app that was launched during COVID that was in order to help track COVID positivity. And it was determined almost immediately after the launch that the app was not accessible to people who use screen readers, for example. So the blind and vision impaired community was not able to take advantage of that application on their mobile device. So that not having been planned and embedded in the plan for the app meant that it had to be corrected or retrofitted. So you want to always remember that your audience may or may not include someone who cannot see the material that you're presenting. So a presentation like I'm giving here this evening, for example, it benefits to be able to describe the full content of what's on the screen for those who might not be able to see it. An example for this evening is we might have people who are dialed in on their telephones tonight who can't see the slides that I'm presenting. So it benefits them if I describe the majority of what's on the slide without assuming that they can see it. That type of principle can be applied to those who do not have a level of vision that allows them to access a screen during a presentation, for example. Those with cognitive accessibility issues need to be given clear information about what's happening to them during their experience, how it will be done, what the process is. And explaining the steps to a person with a cognitive disability can help to allay their fears. It can help to guide them through a process so that they know what to expect next. And that will smooth the way for you to be able to interact with them more successfully. When you describe what is happening or what the process is that you're going to be going through with them, keep in mind that plain language is most successful a lot of times in those instances. Not assuming that the person is familiar with medical terms, not assuming that they are familiar with more complicated information, and using more layman's terms that more clearly describe sort of more simply what it is that they're going to be experiencing can help them to understand and sort of reduce resistance to the provision of the services that you're trying to give them. And so there's actually a specialization or a specific term for this, which is plain language. And there is a whole government website, plainlanguage.gov, that is available for state and federal agencies to be able to vet whether or not their content, whether or not their flyers or their website language is at a level that the general population might understand most readily. So keep in mind that's one resource that you can check into, especially if you're responsible for messaging of any kind, creating flyers, and creating scripts for people to use while they're explaining the process that they'll be going through. Visual information can also be really key in helping people with cognitive disabilities understand what's happening to them or what process they will be going through. So visual information meaning iconography, pictures, graphs, infographics, and allowing people enough time to process what it is that you've told them is also critical. People with cognitive and processing disabilities often need a few extra seconds or moments in order to be able to fully understand what it is that they've heard, and then more readily be able to themselves ask questions if they're not clear on what's happening to them. So waiting a little bit longer than you normally would after you ask a question in order to have that person, afford that person the opportunity to process what you've said and come up with a response, in the end will save you time and energy because you're allowing the person to understand what they've been asked and then give you an answer that might more appropriately help you help them. Language access is a huge consideration, especially in environments where you have populations of various cultural backgrounds, especially regions that have high immigrant populations. Virginia, of course, in the last couple of years has experienced an influx of a number of different cultural groups, including the Afghani refugee activities last year. And so during COVID, it was very obvious very quickly that some of the language accessibility barriers were immediately going to be an issue, because at the beginning of the pandemic, we had what I called an emergency of lack of access to information. And so knowing what the prevalent or most spoken languages in your area are can help you to pre-plan. Say you're going to be assisting with local sheltering, for example. If it is known that there are top 3 languages other than English spoken in that area, because there are large communities of a particular culture from a specific nation, for example, then that's going to help you to be able to access the correct translation services, to be able to get your materials interpreted or translated into the languages that are most commonly spoken where you are. At the beginning of the COVID response, it was decided that the governor's office, for example, would translate the executive orders having to do with COVID into the top 5 languages spoken in Virginia other than English. But then along the way, it became obvious that there was outreach from particular communities who asked for specific minority languages to be used for translation, because there were pockets of language use across the state or the region. So you're knowing more about the communities that you're serving as far as what languages are spoken will help you to be able to prepare ahead of time to know what languages might be most requested during an emergency. And that goes for digital media as well. So anything that's printed in hard copy, signage, for example, at a shelter or at a vaccination site that lets people know the flow of traffic or where the bathroom is. Those are going to be, short-term signage that you're going to hang up just for the event itself. But digital media might be a more lasting resource, and making sure that that's accessible in other languages is going to be critical too. So access to physical spaces is also critically important. Of course, like I said, it's much more common to have people with physical mobility issues because of the percentage of commonality with physical disabilities. And so making sure that your environment is accessible, the physical environment is accessible is going to be critical. You want to make sure that if you are setting up a temporary event, for example, that there is adequate glide path for wheelchair users, that the space is navigable, making sure that the bathrooms are accessible, for example, making sure that the travel paths are clear of any kind of obstacles, and that the surfaces that are going to be navigated are manageable with the wheelchair as well. One thing to remember is that people who have physical or mobility disabilities, which I would include blindness in this as well, often need physical orientation or mobility assistance, but it is very important to not do that without their permission. Grabbing someone's wheelchair and pushing it without asking them, grabbing a blind person's hand, for example, without asking their permission, is sort of like having someone reach out and take your glasses off your face without permission. That's the type of feeling that that a person with a disability may have if you reach out to them to try and provide what you perceive as assistance, but for them it was unexpected and it was not something that they gave permission for, and it takes away the agency that that person has. So just keep in mind that constant communication with that person is going to be really important. Let them know where it is that you would like them to go, ask them if they need assistance to get there, ask them what you can do to assist them, and that way it's a cooperative interaction rather than an interaction where the person feels that they are not being taken into account. People with disabilities, unfortunately, a lot of times have expressed to service providers like me, who's not a person with a disability, that they feel that they've not been given control of their own environment or been included in the conversation. And so not making decisions for that person is very important. Making sure that they are included in the process will help you to assist them in a more successful way. So sort of nested under the disability categories, people with sensitivities of various types. So that might be sensitivity to light, sound, smells, physical touch. And so any of those things might be as the result of, say, a brain injury or some kind of trauma like an accident or stroke. Could be as a result of being a person with autism. For various reasons, sensitivities may come into play. And in a sort of medical environment where you're trying to provide services that, of course, have to do with that person's bodily well-being, it's a little bit more likely that you might have some sort of physical interaction with that person that you have to take into account they may have issues with. Things like being sensitive to the smell of alcohol, rubbing alcohol, for example, or being sensitive to ambient noise, like what happens inside of a large area like a shelter that's being held inside of a gymnasium, or a vaccination center that's being held inside of a large building like those that they use at the raceway, for example. So it might require limiting the amount of time that that person is exposed to those stimuli that they have sensitivities to. It might involve consideration of setting up a separate, smaller area where the person could be treated away from the larger population, sort of out of the mainstream of activity, so that you're reducing their exposure to those stimuli. And also making sure that you consider possibly curbside services. Several of the vaccination centers reported during COVID that they were contacted by family members who said that their sort of young adult children might not react well to going inside of the vaccination center. And so the vaccine was brought to them at the car or at curbside in order to be able to limit that exposure to that person. So that's thinking creatively about how you can provide services to that person to meet them where they are, allows you to take accessibility into consideration. I wanted to mention as well about eye contact. A lot of times people are not sure whether or not eye contact is something that they should or should not try to maintain with a person that they're providing services to. And so following the lead of that person, if they seem hesitant to have you make eye contact with them, either because they have sensitivities, such as a person with autism might have, or maybe it's a cultural sort of consideration, try to respect what that person seems to be trying to tell you with their body language. Again, being observant, allowing enough time for you to be able to assess what that person might need, and asking them what it is that they think might be most successful for them will allow you to be able to provide services to them more successfully too. So communicate with them about what their accommodation needs are. Be clear about the process that they're going to be experiencing, whether it's in processing at a shelter or it's the process of vaccination for COVID. Make sure that you're sort of assessing that person's comfort level so that you can avoid them being overwhelmed, for example. Communicate about the immediate surroundings if they seem scared or unsure of exactly what's going to happen in that environment. Being clear about why it is that you're leading them to a particular space in a shelter, for example, so that they can understand what is happening to them, will help to make them more comfortable. And you need to communicate about that person's level of understanding. So kind of getting that double check of, are you following me? Do you have any questions? Am I being clear? Is there anything you'd like me to review? So making sure that you might have tools available for you to be able to do that means that accessibility might get embedded into the planning stages of what you're doing. So you might have visual aids, you might have plain language scripts for you to be able to read. You might have clear signage with iconography or with pictures so that the person can see the picture rather than having to try and read the words. All of those are ways for you to be able to make that environment more accessible to the people that you're serving. And so assessing what is the language that's most readily understood by that person, figuring out what mode they need that language in. So do they understand it more readily if you write it down versus telling them verbally? Do they understand it better if you have pictures than if you just have words and statements? Making sure that you are conscious of what your pace is. So if you are in a rush, which we often are, of course, in an emergency environment, taking the time to slow down and make sure that you're speaking clearly, make sure that you are giving enough explanation for that person to understand what's happening to them, will be critical in helping you to be able to serve them in that environment. And making sure that you're talking to them and not about them is another important element. So often people with disabilities come into an environment with maybe a personal care assistant, or they might come in with a family member who is used to being the person relied upon to assist them in a given space. And often the sort of tendency is to address questions and information to the person who is providing care to that person. But keeping in mind that the person with a disability is the person there to get the service. And so addressing them directly provides a level of respect to that person. Again, agency and involvement in what is happening to them is important in being able to respect that person. Maybe the personal care assistant or family member is the one who ultimately gives you the answer that you're seeking, but being able to address the person with a disability and recognizing that they are in that space rather than sort of ignoring or talking over them can go a long way to making them feel valued and validated. So addressing them directly is especially important when you're working with a person who uses an interpreter, for example. I can't really count the number of times where, as an interpreter, working to interpret between a hearing and a deaf person, and the hearing person says, tell him, tell him, tell him. And it's not necessary to say, tell him, because that's what I'm there for as an interpreter. I'm there to be able to take that message and get it directly to the person that they're speaking with. So speaking to them directly, instead of asking, does he, for example, you would say, do you? And yes, the answer might come via an interpreter. It might come via a personal care assistant who's with them, but addressing that person directly includes them in the process as the person being cared for. Suggesting having a dry erase board and dry erase markers available in, say, a registration area or in a service provision area can be really important to be able to clarify information, everything from writing down keywords to short statements of fact to being able to draw pictures, even if they're stick figures. Sometimes can increase the accessibility of that information enough for that person to feel like they are understanding what's happening to them in that space. You can also use communication apps, everything from dictation apps to be able to speak into a dictation app and have it print out the text for someone who can't hear spoken language, for example, can be a short-term solution to simple communication access instances. Tablets, apps that connect you with interpreting services, for example, are also critical. But keep in mind that, a person who can't hear you is going to, of course, need access to the information in a different way than a person who can't see you, for example. So if it's a person who has blindness or low vision, making sure that you're describing the environment is important to them as well. So not just the information about the service that you're providing, but information about the environment you're providing it in. Telling them, we're going to go into the waiting area right now, and there's a chair in front of you that's available for you to sit down in, so that they're aware that the chair is there, for example. So giving them environmental information can be important to them as well. And giving them an idea of what's going to happen next, regardless of their disability. Giving them an indication of what's going to happen to them next in the process is important to be able to allow them to adjust, allow them to ask questions, and understand what their experience is going to be. And just keep in mind as well that effective communication is not optional. It really is required. And so going into the service environment with the intention of making sure that communication access is accounted for in your planning is going to help you that much more in the execution stage. So moving on to the next sort of big ticket demographic of access and functional needs populations is people with limited English proficiency, or LEP populations. So what do we mean by that? We mean that these are individuals who do not speak English as their primary or first language, and they may have limited ability to speak, read, or write, or understand English. And so we can label those individuals as limited English proficient, or LEP. So that means that these individuals, again, under the Civil Rights Act, are entitled to language access in order to be able to take advantage of services and benefit from goods and services. So make sure that you're understanding that just because the person doesn't speak English doesn't mean that they don't have a right to the services that you're providing. And again, planning ahead for that access is going to be key to your success. Language access also requires the use of licensed or trained or certified interpreters and translators, depending on what language you're working into or out of. Sign language interpreters in the state of Virginia are not licensed, for example, but there are multiple credentials that are available for a sign language interpreter to earn that would determine whether or not they're appropriate for a particular assignment. Spoken language interpreters can receive credentials as well. And so kind of making sure that you're keeping in mind that these are professionals who provide interpretation and translation services is important, because we more often than not do not want to pivot to using a family member or a friend in order to be able to get translation or interpretation done during a given service. The premise of this presentation is that we're working in an emergency environment. And so when, life is at stake, often we use the interpreting services that are most readily available in that moment, because time is of the essence. But if you plan ahead in order to be able to provide professional interpreting services via video remote interpreting, for example, or a language line that can be dialed into rapidly in order to be able to provide professional interpreting services on demand, is much more recommended than using a child of a family, for example. You don't want to have to go that route, because using a family member, especially a child, is opening you up to not having the level of interpreting skill necessary in order to be able to handle that particular interaction. And so it's much more likely that mistakes would be made. Not to mention the emotional distress that a child, for example, would go through in being tasked with interpreting for a parent who's been injured, for example. So professional interpreting and translating services is definitely the way to go. The difference between a translator and interpreter is sort of a fine one. Those terms tend to be used interchangeably when really they are not. Translators usually work with written text or frozen text, so recorded or written text is what they would be working from into a language that is different than the source message. Whereas interpreters usually are working with an in-the-moment message that is being generated as the interaction goes along. So if you think of the governor's press conferences, for example, where a sign language interpreter is standing up next to the governor while the officials are speaking about a particular emergency, that is an interpretation assignment where the message is being created and interpreted in real time. It's not something that they studied or practiced ahead of time, although interpreters do benefit from having preparation material in order to be able to know enough about the topic to interpret with integrity. You can't interpret what you don't understand. So often interpreters ask for supplemental material, for example. So if you're hiring an interpreter for a vaccination event and you know that there's a particular form that everybody is going to be asked to fill out, that interpreter might look at it and then be able to translate from that written form into sign language or into Farsi, for example. But if the doctor or nurse or medical provider is going to be speaking with that client or that patient, and the message is being created as they go along, then that would be an interpretation of that material. So again, usually you have interpreters on language lines, for example, or on video remote interpreting apps that go from sign language to English. That's usually an interpreted event. But if you have a flyer, for example, that you want to have translated into multiple languages, then that would go to a translation service. And hopefully your organization would know how to obtain those interpreting and translating services. Maybe you have an existing contract with a language company, for example. And my department, VDDHH, can provide coordination for sign language interpreting services for state agencies and the courts. So hopefully, as far as the sort of planning for the event or for the facility that you're going to be providing services in, they've already planned for access to language services, and hopefully the staff who is working that event on the ground at the registration table, for example, knows how to access that. During COVID, for example, the vendor who was in charge of the state-run vaccination centers had a contract with a company that provided language services through sort of a device that was on a stand that was mobile. Many hospitals use that type of a model as well. And so language services were available on demand, and everyone who was on staff knew how to operate those devices, for example. So having the device is great, but the staff needs to also be trained in how to use those translation services. So some key questions for you to ask you or ask yourself or ask the person that you're working with is, what language does this person speak other than English? What is their ethnicity or cultural background? So again, is eye contact or a handshake or gender considerations going to be something that you need to think about? Whether or not this person can be left alone with a person of the opposite gender, for example, or whether or not physical touch is discouraged between people of opposite genders. So that can be a component as well, because if you make cultural mistakes that cause that person to withdraw from you, then they're less likely to want to speak with you about whatever medical consideration they have. You want to just sort of gauge what their experience is with the service that you're providing. Have they ever been to a shelter before? Have they ever had a vaccination at a large vaccination event before? Maybe they've had one at their doctor's office, but they've never had one inside of a room with 100 other people there. And find out what their level of comfortability is with communicating in English. So if they have enough English language proficiency to be able to get through simple interactions, again, along with the assistance of maybe an infographic or some kind of a picture menu, then you could get through without engaging interpreting services, for example. But if it rises to the complexity where they're not understanding what it is that you're trying to tell them, and they can't engage in making decisions for their care, for example, or acknowledging what it is that you're trying to do with them or for them, then language services is probably going to need to be called in order to be able to ensure that you're creating effective communication. So the other thing to keep in mind is that not everyone knows about sort of medical processes. Not everyone understands the difference between the check-in person at the registration desk, for example, and the nurse or medical assistant who's going to take vitals, for example. So you don't assume that everyone has had exposure to a medical environment. And so explaining those processes in the language most readily understood by that person is going to be really important for them to be able to successfully engage in the process with you. So some tips for communicating is to make sure that you're keeping in mind some of the nonverbal communication cues, whether or not they seem withdrawn, whether they're reacting to resistance to closing in your personal space, whether they seem to have facial expressions that would indicate understanding. Making sure that you're not speaking too loudly or too softly. A lot of times the knee-jerk reaction for working with someone who is either deaf or hard of hearing or who doesn't speak English as their first language is that people get louder and slower when they speak. And that's sometimes successful and sometimes not. And so speaking at a natural volume, at a slightly slower than normal pace, with clear enunciation, separation between your words so that you're not slurring your words together, and making sure that you're speaking as clearly as possible to that person facing them and giving them your full attention is going to go a long way to being more successful. Knowing that you should call in an interpreter if you determine that you're not establishing effective communication with that person. And also being willing to use your tools, being willing to use infographics, pictures, designs, color menus, what have you, in order to be able to get across the information that is critical to them. So there are already some really great resources out there that you can take advantage of. And if you plan ahead and have those on hand, then that can be of huge assistance to you in the moment. The Department of Homeland Security, for example, has a tool that they call iSpeak, which is a poster that can be printed out in various sizes. I think they might have a booklet version as well that's printable so that you don't have to print something that's larger than an 8.5 by 11. But it lists, has various languages written so that the person who doesn't use English as their first language could point to the language on the page that they recognize as being their language, so that it helps for you to identify what language they're speaking. Most people recognize Spanish, for example. You might recognize French. You might recognize Italian, but other less commonly spoken languages may or may not be readily identifiable by a person who is not fluent in them. And so having a visual tool for the person to be able to point to the language that they need will help you to be able to then engage the correct interpreting services, for example. There's also a tool that's released by actually the Massachusetts state government through I believe their Department of Emergency Management. Is a great tool called the Show Me tool. And it has all kinds of infographics, everything from check-in all the way through the meal process to sleeping arrangements to asking for accommodations, all related to the emergency shelter environment. And that can be printed out in a booklet form and kept at a registration desk, for example, for people to be able to point to the pictures that pertain to their particular experience and be able to interact more successfully to get the point across to a person or for them to get their point across to you. So knowing that there are tools out there already created that could be prepared ahead of time and at your disposal during events or at a particular shelter event is going to be critical for you. And so it's going to be important as well to be able to reach out to subject matter experts for you to be able to find out what tools are already out there. There's no point in reinventing the wheel. A lot of things are already out there, but of course, as with everything else in the internet, there's so much out there. Sometimes it's hard to drill down. So maybe ask a specialist who is used to working with people with limited English proficiency, for example. What tools do they use at their organization? Maybe it's a refugee organization or a particular state office that works with immigrant populations. Do they have tools that they think might be appropriate for you to be able to then leverage to be used in an emergency environment? One other thing to keep in mind is that low literacy is a component of limited English proficiency. So just because a person can understand a spoken language does not necessarily mean that they can read that language. So there are segments of the Spanish-speaking population, for example, who learn their information strictly through word of mouth, through stories from their family members, for example, because they don't have literacy in their primary language. So English is the same way. And so assuming that a person understood everything on the VDH website, for example, it is a dangerous assumption to make, because even some of the more simplified explanations might be overwhelming to a person who has low literacy. And it's more common than you would think. 1 in 5 adults have low English literacy skills. So trying not to make the assumption that just because you hand a person, a sheet of what to do after, so say maybe they've gotten a vaccination and you hand them a sheet of what to do after their vaccination, they may or may not actually be able to read that content or read it with proficiency enough to understand it. So making sure that you're asking them if they have a full understanding. Sometimes people are embarrassed and they're not forthcoming about their level of understanding. And so briefly going over any material that you give them to allow them an opportunity to ask questions while you are reviewing it with them helps to bridge that gap between their level of literacy and their level of understanding for critical information. So again, sometimes they conceal their level of literacy by making statements that kind of deflect or defer you from figuring out that they're not really understanding the material they've been given to read. They might say they don't have their glasses with them. They might say they're too tired to read it right now. They might say, oh, well, I'll just read it when I get home. And that may be the case. They may have someone at home who is able to assist them in being able to read that content. But giving them the opportunity to ask questions or reviewing it with them before they leave often helps poor readers to be able to ask questions and get an explanation from you, the experts, rather than relying on people at home who may not have the answers to their questions. Keep in mind as well that people with low literacy often miss appointments. They often make errors in medication directions. And so if you can identify that a person has issues with being able to read more complicated written material, then again, meeting them where they are and providing them with more simplified versions or reviewing it with them can help them to understand the critical information that you're trying to give them. So again, tips for being able to get your point across. You want to try and make sure that the translations and interpretations that you're giving a person have been what has been termed a lot during the COVID-19 response as trans-created. It sounds like a made-up term, but it really is not. It's a term that can describe the process of taking information from one language into another, not just interpreting it or translating it word for word, but making sure that the concept is clearly carried from one language to another and making sure that it's culturally appropriate. A great example of that is, interpreting jokes from one language to another often is one of the most difficult interpretation tasks because you're not only interpreting the words themselves, you're interpreting the meaning behind those words. And so making sure that you don't have only word-for-word translation available, but live actual translators and interpreters who are able to make culturally appropriate, culturally appropriate changes to that message so that it fits the audience. Also, making sure that any video or audio content that you create has the components to it to describe to the audience who either can't see it or hear it. Making sure that the videos themselves are culturally appropriate, that they have captioning included, captioning that is not created by a machine, or if it is created by a machine, it has been double checked by a real person who can edit the mistakes and make it more accurate. Infographics are also a really great tool. Lots of them are available out there for medical environments, and they use diagrams, graphs, icons, and colors. For example, the one that's pictured here is one that is a page out of a COVID infographic that was created by the American Red Cross a few months into the pandemic, in order to be able to provide information to people either who don't use English as their first language, might have cognitive disabilities, developmental disabilities. And so it imparts critical informational elements with simple text supported with iconography. And don't discount the value of storytelling. So if you are sharing information for a person who's come in with a family member, for example, making sure that you're sharing it to both of them so that later on that family member can then support that person asking questions. They can both remember what it was that you said to them. And they can also share that forward to their friends and families. They go home and tell that story to the people that they see at the grocery store, the people that they see at church. And so if you impart information to someone during your activity, they may share that forward into the networks of people that they're interacting with. Also, just one word about types of literacy very quickly. There is literacy that has to do with reading and writing ability, but it's important for you all to be aware that health literacy is also a huge consideration. It became obvious very quickly during the COVID-19 response that, because of cultural limited exposure or because of limited access to resources, being economically disadvantaged, and not having had continuous health care, people were asking questions about COVID-19 as an illness, asking questions about testing and treatment, and not understanding the answers that they were getting because they had not been exposed to those terms. They hadn't been exposed to the health system to a large extent. And so not only were they not understanding the words that they were hearing, they were not understanding the medical environment that they were hearing it in, and being able to gain access to that information at a level that they could understand. So again, a person might be able to read the words, for example, but not be able to understand the meaning behind them because they've never been exposed to words like contagion or efficacy or transmissibility. But if you use words that are more simplified, like efficacy would be, how long does this help me? How long does this vaccination, how long will it protect me? Right. So trying to use terms that people would understand who have not had a medical background helps to kind of break down some of the health literacy barriers that you might see in a particular population. So older adults is another demographic that is most commonly seen in, say, a shelter environment. And so the older population has particular considerations that you can keep in mind. We do have an aging population. And so, it's projected that as we go forward into the next decade or two, the number of people who are older is going to increase proportionally. And so the demographics of people that we see in service provision environments across state government is going to be aging. So knowing what the key considerations for successful interaction with older adults are going to be helpful to you in the environments where you're trying to provide services. Of course, culture plays into it as well. So a person who's been raised in mainstream American culture, for example, is going to have different considerations than a person who's been raised in mainstream Hispanic culture, for example. But by and large, people who are older generally start to have challenges with their ability to hear clearly, to see clearly, and to understand complex information, or if they understand it, they might struggle with being able to remember it. So keeping those aspects in mind can help you toward establishing effective communication with a person who is generally seen as being in an elderly population. You're older than 65 or you're older than 75, depending on what services you're providing. You want to make sure that you understand that there's a higher percentage of people who have a disabling hearing loss the older that they get. So 25% of people who are 65 to 74 have a disabling level of hearing loss. 50% of those over the age of 75 have a disabling hearing loss. So the older a person gets, the more likely it is that they're not going to hear successfully without assistive technology. And that can be for a variety of factors. It can be anything from exposure to loud noise over time. Maybe they had a profession that exposed them to machinery for sustained periods of time that had high decibel. Or it could be something that is that happened to them in later life, like a stroke or some kind of sensory neural hearing loss. The same type of proportion happens for vision loss. The older you are, the more likely it is that you might have a level of hearing loss that inhibits your ability to interact independently. So, it goes beyond the correctable. So you're not talking necessarily about a person who just needs glasses as they age. It might be a person who needs additional light in order to be able to see. They might only see at a short distance rather than a long distance. So they see you clearly at 5 or 6 feet, but not clearly at 12 or 10 or 12 feet. So that type of consideration became really critical during COVID, for example, where social distancing was requiring us to be a minimum of 6 feet away from a particular person, but older adults tend to want to be closer to the person they're interacting with because they see or hear the person more successfully at a shorter distance. So social distancing has been a huge factor in accessibility for older adults, for people who are deaf or hard of hearing especially, and people with vision difficulties. Cognitive decline is also a component. So those who are 65 and older, almost 12% of people 65 and older have some kind of cognitive decline that has been recognized as inhibiting their ability to understand or remember something. And that is compared to a slightly lower percentage of people who are younger than that. So it's not quite as distinct a difference as you get older, but it is something to keep in mind that there's the potential for misunderstanding or the potential that the information that you give them is understood in the moment, but may not be retained or understood, remembered later. So when you're dealing with someone who is in the older age demographic, respect and understanding is a critical component of being able to build a successful rapport with that person. So keeping in mind that patience is going to be particularly important, and making that person comfortable may go a long way to a successful interaction with them. And again, the goal is not necessarily to keep that person happy. It's not necessarily to, satisfy every need or want, but it's your attempt to make sure that you've established effective communication with that person and established a successful rapport in order for you to be able to provide the service that you're looking to provide to them. Using acting listening skills is also important. So asking good questions, repeating back to them what you feel that they have told you, so that you make sure that you understand them, and vice versa, giving them the opportunity to ask you clarifying questions in case what you said did not make sense to them, or in case what you said, they might not have been able to hear what you said. And one note about that as well, often when you make a statement, a person says, "I'm sorry, what?" or "Can you repeat that?" Our For some reason, our response to that often is to rephrase what it is that we said. But often it's more helpful to just strictly repeat exactly what you said before so that they can hear that same message in the same format one more time to give them the opportunity to understand it the second time that they hear it. If at that point they don't understand what you said, then you can try various ways of resolving that. One is to move closer to them. One is to enunciate what you're saying more clearly. The other is to then go ahead and try and rephrase, because maybe cognitively they're not understanding the words that you were using. And so rephrasing in that instance will help them. So just keep in mind that try to repeat exactly what it is that you said the first time to give them that second chance. And from then on, you can try and rephrase or reposition yourself so that they can understand you a little bit more clearly. Avoiding medical jargon is another key element. Again, that plain language component, being able to explain what you're doing or the information you're imparting without using more complicated terms. Usually, plain language, technically speaking, is at about a 4th or 5th grade reading level of complexity of vocabulary. So keeping in mind that it's not to insult the person's intelligence to use a 4th or 5th grade level of language complexity. It's using that in order for the message to be accessible. So you're not speaking down to them by doing that. You are making the message itself more understandable. And from there, you can establish shared understanding, and they can then ask more questions in order to be able to elaborate or clarify what it is that you have, the information that you have to give them. And again, demonstrating empathy is important, because becoming frustrated or dismissive or rushed will only shut down the rapport that you're trying to build with a person, and rapport is essential for effective communication to be established. So again, short, simple words, simplifying your instructions, allowing extra time, communicating face-to-face so that they can actually see your face, can read your expression. That's going to assist you in being able to interact more effectively with that person as well. And one last demographic I just wanted to touch on briefly is people with limited access to transportation. That doesn't necessarily occur to people right off as a category that has access and functional needs, but we still need to be able to provide services to those who cannot or do not drive. So by that, I mean people who are wheelchair users and who do not drive the vehicle themselves, but also people who do not own a car, who have economic disadvantages that keep them from being able to have transportation of their own in order to access public services. So when you set up an event, for example, or you've decided on a location, it's always good to make sure ahead of time whether or not transportation to and from that service might be accessed by a person with disabilities or unique health needs. Is that location accessible through public transportation or paratransit? Some bus routes, for example, are accessible to larger buses that might have wheelchair lifts, but there might be the opportunity to put an event on a paratransit route, for example, that would more readily be available to people who have other types of disabilities that would prevent them from being able to drive. So where you're providing the service, your plan for providing the service, all is one thing leads to another. And so then the person needs to be able to register for your activity. They need to be able to arrive at your activity through their own transportation or public transportation. They need to be able to get from the parking lot to the building. They need to be able to get through the registration and service provision process, and then understand the information that you're giving them, the departing wisdom that you're giving them, and whatever follow-up information you want to give them after you provide the service. So all along the way, there are accessibility considerations that you can that give you the opportunity to bake in accessibility into your processes. So my parting advice is, if you don't know about a particular type of disability, or you have a particular demographic that is often showing up at your events and you'd like more support in order to be able to provide accessibility to them, ask subject matter experts that can assist you. We have disability services agencies here in the Commonwealth, like mine, the Department for the Deaf and Hard of Hearing. There's the Department for the Blind and Vision Impaired, Department for Developmental Services, Behavioral Health and Developmental Services, for example, Department of Aging and Rehabilitative Services. So there are subject matter experts out there that you can contact to help you in your planning stages in order to be able to find good resources for you. Designating a person at your event that can oversee accessibility planning and execution is a first great step. Having a point person who can, make sure that accessibility is included in the planning and execution is a critical element. We found that during COVID. Unfortunately, as access and functional needs officer for some time, I was one of the only people that whose name was kind of out there attached to access and functional needs. But the irony of that is that I very rarely solved problems on my own. I was the point person for people to be able to reach out to with concerns. And then I was able to reach out to subject matter experts who were able to assist with a particular need. And so asking good questions and using the resources that we have available in the state was critical to the success that we did have during COVID in increasing accessibility. Making sure your consumers know how to have an avenue for requesting accommodations. So does your website registration page have an email address listed for people to be able to send a message to for asking for interpreting services, for example? Considering having an expedited assistance line or table at your registration so that you can funnel people with access and functional needs to an area so that you can then address those needs and be able to assign someone to assist them with their accommodations, for example, can be one way to sort of make registration process more smooth, for example. Keep in mind, you should not separate the person from their accommodation, meaning that if a person arrives with a personal care assistant, with a service animal or an assistive device, don't separate them from the accommodation that they've arrived with. Sometimes privacy issues are a concern, or being concerned about having a service animal in a care environment. But those are permitted. Those are accommodations that person has a right to. So do keep them together with the accommodations that they arrived with. And don't make the decision for the person with access and functional needs. Include them, make sure that they have agency over what happens to them in that environment, including them in that process. And don't assume anything. Ask good questions, because the person is more often than not the expert in what their needs are, and they can assist you in making sure that you're establishing effective communication or providing full accessibility to them. But again, keep in mind that that person doesn't need to tell you why they need an accommodation. They only need to explain what accommodation might work well for them. So here at the end, I included some URLs that I can go ahead and give this PowerPoint over to your team to be able to send out to you all. If you're interested in seeing these, I would probably change them to make them hyperlinks. I tried to make them into hyperlinks and it changed them into a color actually that was not compliant with digital presentation color contrast. So I had to turn them back into non-live links. But as you can see, the resources that these come from are everything from VDH itself, the vaccination site accessibility guidance that we worked up during COVID, the Department of Health and Human Services language access materials, FEMA, Department of Social Services. There are plenty of resources out there for you, and this is just a tiny short list of ones that off the top of my head I thought might be useful to you all if you got a copy of the PowerPoint. So with that, I know I'm running up against time. Hopefully we have enough time to be able to answer a few questions. I'll go ahead and unshare my PowerPoint here. And that way I might be able to see the chat a little bit better. But Kate, if you could help me with So channeling some of those burning questions that might have come up while I wasn't watching the chat, please feel free.
Absolutely. It looks like the main question is, can we get the slides?
Sure. And having said that as well, please keep in mind that this is very much the Cliffs Notes version. Each one of these topics, each one of the demographics that's nested under access and functional needs, sheltering, emergency activation events. There's so much that's just a tiny little mention in this PowerPoint that could turn into, another 2-hour presentation for each topic. So if there's anything of interest to you in the PowerPoint and you would like further information, please feel free to reach out to me. And again, I might not ultimately end up being the person who gives you the answer to your question. I've been able to, thankfully, have a great team throughout state government who I've been able to toss questions to, and I would continue to do that. Experts in blindness at the Department for the Blind and Vision Impaired, for example. That's not my jam every day, and so I more often than not would field questions over to them, and then that can be become a rapport that you can build with the folks over there at that department. So, were there any other questions that you wanted me to address?
Does anybody else have any other questions? So in order to get credit for your attendance today, please go to the roll call page, which I've dropped in the chat. And the secret phrase is functional needs. So I'll ask you at the end, what's my secret phrase? And that's what you will put in there. You can also reach out to me. I'll put my email address in the chat if you have any questions. We're getting a lot of excellent presentations. Thank you so much. I know a lot of that stuff really, I was like, wow, we could have used that when we started testing, or wow, we could have really thought it would have been amazing to have that person that you were talking about, to just that one person to just think about that would have been wonderful.
Yes, I will say that one of the biggest lessons that came out of COVID was, and really just to give a tiny 30-second synopsis, I was asked to become the Access and Functional Needs Officer in January of 2020 because the person who had just started it, who had just kind of created it as a role that could be taken on by someone at a Department of Emergency Management, moved to another state. And so they didn't have anyone in that role. And my director was considering letting me do it on top of my day job. And then COVID happened. And